everyone. Today we're going to talk about another real case of Dr. Yackaman of my patients. But in this case, it's close to me because it's a patient from Mexico. He was introduced to me by my partner at the time, Dr. Miguel Noriega, who's a prosthodontist now. And he told me about this family member that he was having infections. They did a root canal. This is impressive to me. In 2 teeth on the front, that is not difficult to do the root canal in these 2 front teeth. And the dentist who was not an endodontist, but even if he was, the dentist did, the patient 6 months later and a year later started having so much pus all the front. Imagine your gums full of green tissue, that viscous, that is the pus, and then he started pressing, so the pus started coming down. By the time he got to me, he still was coming out of pus. I helped him to drain. But the moment that I saw the patient and I asked for advice to my chairman, because we're talking about the 90s, I was an endodontist, but I was not in the United States yet. So my teacher said, do the right thing that I know, which means open the tooth, clean and clean and clean and wash. How do we clean? We use instruments that are hand instruments, rotary instruments. We use the hand irrigation, and also I have an endoactivator, which is a machine similar to precipitate the liquid that we use to wash the canals. And we have also a way to be sure that this treatment was going to work if we are irrigating during the whole treatment. I left in between appointments antibiotic, and when the patient came back 2 weeks later, I gave him. He was perfectly healthy. He didn't have any problems. And from there, I was able to follow up for 7 years this patient. Now I only know by phone that he's doing great, that he's very grateful. I wish I can get an X-ray of this patient. But the key here is that you understand, if you have a root canal that is bothering you, or you feel like it's pus coming out of your gum, you have to contact immediately to your doctor to make a better decision what to do with your tooth. That in this case, avoid at all costs the surgery, because we're not talking about money here. We're talking about saving your tooth and having the structure that we need to restore it. So this tooth, from the way it was in this part and the way it looks in here, it's a big healing, and as of today, I've seen the patient and the patient is doing okay. So if you have any questions, please put your comments in YouTube, Instagram, or TikTok, and I will be able to answer your questions or comments. Take care, and I hope you like this episode.